Hello, everyone, and welcome to today's webinar Understanding Hodgkin Lymphoma. So, what are the myths, hopes, and awareness? So, we have Dr. Shouriyo Ghosh with us. So, welcome, Doctor. How are you?
Hi, thank you so much for inviting me. I'm doing fine. So I'm currently a doctor and a clinical hematologist at Tata Medical Center, Calcutta.
Yeah.
So it's a dedicated cancer care hospital.
So, today we're going to talk about this Hodgkin lymphoma and we're going to discuss about the positive lifestyle, uh, how to overcome this lymphoma, and everything.
Right. Please go ahead.
So, my first question is let's begin with the basics. So, what exactly is Hodgkin lymphoma and how is it different from other type of cancer?
Right. So that's a good question. So Hodgkin's lymphoma is a kind of lymphoma, and what I mean by lymphoma is a tumor or a cancer of the lymph glands in the body. So we have some normal structures called lymph nodes or lymphoid organs in the body. These are basically helpful in providing us with the immune system that we have. So if there is something abnormal that goes on in here, we get a tumor which is called Hodgkin's lymphoma. It is a type of lymphoma. We have whole lot of different types of lymphomas. This is one such kind of lymphoma that happens. Yeah.
So, how common is this Hodgkin lymphoma, especially in India?
Right. Right. So Hodgkin's is so as a tertiary cancer care center, we do get to see a lot of Hodgkin lymphoma patients from all across the country. It is quite common. Out of the lymphomas, if you consider all cancers, out of that, lymphomas are not as common as other kinds of cancers. But within lymphomas, Hodgkin's comprise approximately 20, I would say 15 to 20% of all lymphomas that we see. I
Okay,
would say 10 to 15% of all lymphomas. Yeah.
okay. And what are the symptoms to watch out for?
Right. So, and before that, I would like to say that Hodgkin's usually affects the younger generation, the younger age group of patients. So, patients in the age group of 20s to 40s, they are more commonly affected by this tumor. And in the other Western countries, we get to see slightly older patients as well. But in India, it's mainly we see in the younger patients. And so the symptoms are, patients can present with generalized weakness, not being able to do their normal activities, just feeling weak and fatigued all the time. Patients can present with, like I mentioned earlier, swellings of the lymph glands. So there are glands in the neck, in the armpits, in the groin. So there can be swelling of these glands. The swelling is usually painless, right? And it usually grows to visible sizes over a period of few months. So patient may have fever. So another very significant symptom of Hodgkin's patients are they do have fevers, and they can also have weight loss. So fever, weight loss, feeling weak, fatigue, and then swelling of the glands. These are the common symptoms that we see.
Okay, so once someone sees a doctor with these symptoms, how is Hodgkin lymphoma diagnosed?
Right. So once we see such patients, we do some routine blood investigations to see certain parameters of the blood, like the complete blood count, the hemoglobin, white cell count, etc. Along with that, we clinically see the patient and see where all we get such nodes. We usually go in for a biopsy of these nodes. So before going for a biopsy, we would also like to rule out other common conditions which can mimic, a lymphoma. So sometimes we have to make sure that the patient, we are not dealing with, let's say, a patient of tuberculosis or a patient who has had lymph gland swellings in the neck because of a dental infection, or for that matter, an infection of the tonsils, right? So after ruling out common conditions like that, we to confirm the diagnosis of Hodgkin's lymphoma, or for that matter, any lymphoma, we go in for a biopsy. What is a biopsy? A biopsy is sampling a little piece of tissue from the lymph node that is swollen. So it can be done in two ways. One is the patient can undergo a small surgery where a little incision is made and a piece of tissue is extracted. This is done under anesthesia. The other option is that we stick in a needle and take a little piece of tissue with the help of that needle. So the needle biopsies are painless usually, and they don't cause that much discomfort. And it's usually done on an OPD basis. So patient comes in, we do a biopsy, and the patient is good to go home.
Okay.
So based on the findings of the biopsies, the pathologist usually gives it, and there are some special tests also which are run on that piece of tissue that has been taken out. Based on that, a final diagnosis of Hodgkin's lymphoma is made.
Okay. So, what does the treatment journey look like for someone who's diagnosed with
Right.
Hodgkin lymphoma?
Right. So at the outset, I would like to say that Hodgkin's lymphoma is one of the curable cancers or curable
Okay.
lymphomas that happen to young patients. So patients are quite anxious. The parents are anxious. Everybody's anxious that what will happen? What will I do? So the first thing that we tell the patients is that it's good news is it's curable to a great extent, and there are a lot of new treatments that are available nowadays, which are safe and offer a very high percentage of cure to the extent of, over 90%, right? So before starting treatment, we get some like basic blood tests, like I mentioned, and also some other tests like an echocardiography of the heart, breathing tests, which is called pulmonary function test, and also a staging workup, which is basically a CT scan of the whole body to make sure that we know where all the glands are. So basically, where all the glands are is essentially what we commonly known as staging of a cancer. So after we get all this baseline information, chemotherapy is started. Yes, Hodgkin's is treated with chemotherapy, and nowadays there is chemoimmunotherapy. So there are some very potent and targeted treatments called immunotherapies which are available. One such is brentuximab. There is another one which is called nivolumab. Along with that, chemotherapy is added and the combined treatment is given to cure this disease.
Okay. So, how much?
Uh,
Yeah.
Sorry, yes, please go ahead. Yeah.
So, how much difference does early detection really make?
Right. So very good question. So earlier the detection, let's say there is a patient who comes in with one gland just in the neck, and we do a scan of the body and determine that yes, that's the only gland which is swollen, that's the only gland which is involved. There are no such glands elsewhere in the body. So essentially that is stage one disease. And like I mentioned, the cure rates are highest with stage one. I mean, stage one is the highest cure rate. And even in stage four, so this is important to note for all the viewers and listeners, stage four disease Hodgkin's can also be cured. It is not as if that if the stage is advanced, that the cure rate is not possible. It is still possible, but the percentages are slightly lower than that of stage one disease. So if I may rephrase it, so let's say you have stage one disease, the cure rates are more than 90%. If it comes down to stage 4 disease also, it is curable, but the percentage are slightly less.
Okay. So now, let's take a moment to clear up some common myths around Hodgkin lymphoma.
Right.
So, myth number one: only older people get Hodgkin lymphoma.
So, like I mentioned in the beginning of the talk, older people, yes, they can get Hodgkin lymphoma. It is more common in the West. In India, we don't get that many old patients with Hodgkin lymphoma. But yes, older people we do see, but the incidence is slightly less than that of the West. And with the newer treatments like immunotherapies and targeted treatments, even older people can be completely cured of this disease
Okay. So, myth
with
number
less
two.
side effects. Right.
Okay. And myth number two: swollen lymph nodes always mean cancer.
No, no, that is not true. Like I mentioned, swollen lymph nodes can be seen in many other situations. You may have had a dental surgery, you may have had a dental infection or
Hmm.
a caries in the tooth, you may have had tonsillitis. You may have had a soft tissue infection somewhere else or an abscess. That can also lead to swelling of the lymph nodes.
Okay. So cancer treatment always leads to unbearable side effects.
No, that is not true. Cancer treatment can also, like I mentioned, it has there are a lot of targeted treatments nowadays. And with the help of targeted treatments, cancer side effects can be minimized. Side effects of chemotherapy can be minimized. And in that situation, the treatment is not as unbearable as it appears to be.
Okay. So the last myth is if Hodgkin lymphoma comes back, there are no options left.
Yeah, so this is also a very important point. And like I mentioned, if you have, so I mentioned that let's say somebody has stage 4 disease and the percentage of cure is less. This means that the percentage of cure is less even in the first round. So let's say what happens with somebody who is not cured with the first round of chemotherapy or with the first type of treatment. So that is what you're mentioning, that if the disease either comes back or it is not controlled with the initial chemotherapy, there are many more treatment options still available which can still cure the disease. So the patients need not worry if the patient does relapse. We do have a lot of treatment options available nowadays which can be used to still cure the patient.
Okay. I think we have cleared the most number of myths. And let's move on to the next segment, living with
Yes,
and beyond Hodgkin lymphoma.
right.
So the first question is, how can patients and their families cope emotionally with the Hodgkin lymphoma diagnosis?
Right. So it's a very difficult time. We all understand that patients, their caregivers, family members, near and dear ones are quite anxious and, I would say taken aback at the diagnosis of cancer. But we are there to help. We usually counsel patients and their family members regarding the positive aspects of treatment and cure. We also tell them about the side effects and how to manage them. So by allaying the anxiety, that is the first step at, I would say, coping. That is the first step. Secondly, we do get to see patients who still have coping difficulties, right? With various, there can be various issues. It can be financial stress, it can be work-related stress along with the cancer. It can be body image issues where patients will lose hair or patients will, people will realize that the patient is undergoing chemotherapy. So there can be so many stressors which can lead to coping issues. And as doctors, we help the patient with these issues. We also have a very good psycho-oncology team. Most cancer centers have psycho-oncology teams and counselors where, if required, patients and their family members are counseled and they can share their fears, anxieties with the counselors, and that can help, allay such coping issues.
Okay. So can individuals return to normal life after treatment?
Yes, absolutely. So even while taking treatment or after treatment, individuals can have totally normal life, and they can completely, they can lead a normal life.
Okay. So as we wrap up, Dr. Shouriyo Ghosh, what is one message you would like to give to the public?
Right. So I would like to say that if there is a suspicion that somebody in your family or somebody, or I mean, the patient himself or herself, or somebody gets a diagnosis of a cancer, or is there a there is a suspicion of cancer, please visit the hospital which is dedicated for cancer care. Please visit some healthcare provider who can diagnose and work up the patient properly, and then take appropriate treatment. So it is not true that cancer has no answer. Cancer does have lot of answers nowadays, and people do get well and can lead normal lives after treatment. So I would like to say that all is not doom and gloom with cancer.
Thank you, doctor. Thank you so much for sharing your valuable insights in such a simple and reassuring manner. And thank you, viewers, for watching. So this is message. This message is a part of disease awareness initiative by Takeda Pharmaceuticals India Private Limited, shared in public interest. And thank you so much.
Thank you. Thank you.